Hello, it is my pleasure today to welcome you to the 11th in our series of 12 interviews on the behalf of Planetary Health. My name is Teddie Potter, and I'm Director of Planetary Health for the School of Nursing at the University of Minnesota. This session, or this month's Planetary Health lesson, is the whole idea around being a global citizen. And how the Planetary Health principle defines this is a global citizen is someone who sees themselves as part of the international community and whose actions help define the community's values and practices. If students can realize their own cultural identities and recognize their inherent membership in both their local and global communities, they have an opportunity to help define the values and practices of the next generation to positively affect those communities. So as you recall, this month's ambassador was the monarch butterfly because it holds dual citizenship. It resides in Mexico part of the time, and it resides in the United States part of the time. And if you take a close look, the monarchs are coming through right now, at least if you're in Minnesota. And it's really exciting. Once you know more about them, you can watch them and watch their different phases develop. And it gives you a whole new appreciation for these very, very important little beings that help pollinate our foods and help keep us healthy. So speaking of a pollinator, I can think of few people I know who are more wonderful pollinators than Marie Manthey. Some of you who are new to the School of Nursing might not know who Marie is. So let me take a minute to sing her praises. Marie Manthey started Creative Healthcare Management, which is a large healthcare management organization, nurse-led management organization. She also was the pioneer in developing primary care nursing, a nursing care delivery model that is used not only in the United States, but throughout the world. And Marie's one of the few living legends that you will have a chance to know or meet. A living legend is somebody who has transformed and had a huge impact on the global nursing profession, but is still alive, not like Florence Nightingale or Claire Barton or one of those legends. This is a legend that's still very much alive. And Marie is very much alive, and she's very much a friend of the University of Minnesota. She engages deeply with the University of Minnesota students. She's supportive of university faculty, and she is a dear friend and colleague. So welcome, Marie. I am so glad that you're able to be with me today and answer some of the questions that we have about global citizenship.
Well, thanks, Teddie. I'm glad to be here too.
Well, good. You've had a remarkable career, and you've had the opportunity to speak to nurses all over the world. And yet you've mentioned that nurses, no matter where they live, seem to have a common thread. And so could you speak about that? What do we have in common, no matter where we live?
Right. When I started speaking internationally, I thought that there would have to be a lot of adjustments and translations of principles and beliefs and values and practices. And I found that once the language issue was dealt with through translators, that there was a bonding that was very similar to when I spoke to nurses in America. There was an immediate recognition, a connectivity, a sense of belonging together that was amazing to me. And as I did more than just speaking, as I went into the hospitals, met with nurses at the bedside, had the experience of seeing how their culture, their language, their history as nurses, as a nursing profession, impacted their behavior and thinking. However, there was one thread that never changed, and that was the sense of nurses being at the bedside in a relationship that was healing with the patient, no matter what else was going on. I think one of the biggest differences I experienced was in the way nurses were perceived in the culture.
Right.
So in many cultures, nurses are perceived much as they are in the United States, quite respectfully and with a good amount of self-respect about themselves as nurses. But in some European countries, nursing is considered a low-level technical assistive role. And in those countries, the nurse's perception of their own value in society suffers tremendously from their low level of recognition and respect in society. So that's the one biggest difference in many ways that I saw globally, how the culture rates the nursing profession has a profound impact on the way nurses feel about themselves in terms of self-respect. But the joyful thing for me, Teddie, was just always finding that connectivity. You know, I've run salons in other countries, even where there's a language problem. And as soon as we start talking about practice issues or about the meaning of nursing or about the experiences nurses have had, there is that deep connectivity. We are the same. There is a sameness to the practice of nursing that I think transcends all boundaries. I've been in Turkey, I've been in Japan, I've been in China, I've been throughout the world, throughout European countries, and it's always the same.
Yeah. Which really brings me to the practice of being a global citizen. So my original question was, how do you practice? And you in a way just answered, but I'd love to have you give more details to the people viewing this video. And that's about the salon experience. Could you describe that?
Sure. Nursing salons is something I started about 20 years ago in Minnesota. And as we began to meet in my house just to talk about nursing in a rather unstructured way, as it evolved over the next couple of years, I discovered the Socrates Cafe format for managing conversations, and it began to become a regular event in my living room. And because I knew food was always important for good conversations, and because we were doing it after work, I started off preparing dinner. So the early salons, and right up until COVID, that I personally hosted in my home, where meals were included meals that I prepared. Now, throughout other countries, I have been asked to instigate salons, to start them and help people in those countries figure out what they're going to do, how they're going to host them. And again, it's the same thing. It's the same sense of being deeply connected. And again, once the language barrier is overcome, then that deep connectivity starts again. Now, what happens in a salon is that people come and talk about whatever's on their mind about nursing at that time. And the result of that, 9 times out of 10, I would say we get into a depth of understanding of the importance of our practice, of the values of what we do, that ends up with a deep sense of appreciation for ourselves, for our practice, and also almost universally, people on the checkout, what's on your mind about nursing now? After, what are you taking back from this discussion? Hope. And they never come in with hope as one of the things they need to talk about, but they leave with hope about themselves, about nursing, about the future, about the world. So that is a byproduct that I had no thought about seeing.
Well, I can provide a testimony because I have been involved in a salon that you led in Iceland, which had a lot of faculty and students from the Baltic nations, Iceland, and Scandinavia. And you described it, you hit it exactly right, of people entering in, they're a little shy, they're a little timid, and before long, we're sharing stories that are universal, stories of loss and grief, stories of hope, stories of what nurses can do to shift systems. And before long, they're going, oh, you have staffing issues too? Oh, we do too. You deal with burnout? Oh, we do too. And you begin to realize that you're not working alone, and that you hold tremendous power when we find each other, and when we can connect, and when we can create change. So the salon is a wonderful piece.
Teddie, in Zoom, I mean, in COVID, I started a Zoom one. And then now it's over with, and we began to wonder what should we do. So we ended up, we're going to do 2 a month. one face-to-face in my home and one Zoom, because the last Zoom, we had nurses from 5 states.
Right.
We had nurses who were pre-licensure to me in deep retirement, so to speak. We had faculty from 2 different schools of nursing. We had an insurance person. We had an amazing nurse executive, amazing group of people from 5 different states. And it was so much fun to make, again, those connections.
Right.
And so the solution is we're going to do both. There is going to be a Zoom meeting every 3rd Wednesday of the month, and anybody from anywhere in the world is welcome to join.
And that was my question, Marie, is how do they find that? How do they sign up for it?
The link is always on my blog, my personal webpage, which is mariemanthey.com.
Great.
So www.mariemanthey.com will take them to the blog, which has quite a bit about salons, including the link that is always the same.
Great. And so that is your invitation to participate in a global conversation, a national conversation of nurses coming together who are not saying, I'm done. They're saying, I'm going to lean in. Even though times are really tough, I'm going to lean in. So Marie, my last question is really inviting you to think about what message do you want to give the young nurses that are just starting their career? What should they hold fast to? And is there a reason to hope?
Is there what?
Is there a reason to have hope?
I'm still not hearing that.
Oh, can we have hope? Is there a reason
sure,
to hope?
sure. Well, the essence of nursing is it's an art and a science. And thank Florence Nightingale for being clear about that. The art of nursing is the relational part of nursing. The science we get well indoctrinated in, and we understand it as much of our practice in hospitals, especially. But always, no matter where nurses practice, whether in hospitals, long-term care, home care, whatever, it's the relationship part of our practice, of our profession, that is consistent, is important, is never going to change. It is never, ever, ever going to change. Artificial intelligence can come, at some point in the future, but the essence of that relationship between the nurse and the patient is not ever going to be irrelevant or unnecessary. And it is one of the most difficult things for new grads to be able to actually do while they're concentrating so hard on getting that science right. But after a couple of months, I say usually 3 to 4 months of learning what needs to be learned, they need to then start building the relationship part of their practice in very, very intentionally and with personal discipline, because the system is not going to ask them to do it. They're not going to be held accountable for it with any measurement stick that we have in healthcare. And it's a matter of personal integrity to the values of the profession that we need to make sure young people understand that once they get that technical part under their belt, so to speak, or if they're not working in hospitals, to bring the relationship part right in, because that is the essence of nursing. And as Virginia Henderson taught us, our place in healthcare is dealing with the vulnerability that humans have when they are experiencing a health problem. And we are the ones who own that vulnerability. We are the ones that the society tells us we can do things on their body that they can't do for themselves. And we are the only ones that hold that privilege. And that privilege needs to be carried out within the context of a personal relationship.
Well, thank you, Marie, for joining us today. And those of you that are listening, you have just heard a remarkable message of hope and encouragement for all of us that practice this profession. Marie, we are so grateful to you. We're so grateful that you have continued to pollinate and spread your wisdom across the nations all through your career. And you're such a wonderful role model for all of us.
Thank you. I'm just doing what comes naturally, just like the butterflies.
There you go. There you go. Take care, everyone. Thank you.
Thank you.